always thrilling when I get to talk to champions, and these three are superstars. Welcome to the three of you. Lori, hello again. So nice to see you. Madalyn, we haven't met, but hello and welcome. And Yesenia, my old friend in New York City, hello. So I want to get right into this because it is something that we have been obsessing about for the last year, the interaction between heart disease and COVID. And I know each of the three of you have had very different experiences. And so I want to get right into it. Let's start with you, Lori. I know that you haven't had COVID, but a lot of people around you have. Can you talk a little bit about the challenges that you faced in trying to stay healthy yourself, given that you have heart disease and you're dealing with heart disease, and have been told time and time again that if you have heart disease, you're at a higher risk. So talk a little bit about dealing with that and then dealing with family members who were affected.
My doctors suspect that my heart failure was caused by a virus, so I was sensitive to the damage that a virus can cause from the very beginning. And my adult children were super sensitive to that. They all live in what were early hotspots in the pandemic, and all in different states. And so I went for 10 months without seeing any of my children. They were extremely protective, on high alert because I was at higher risk. It was sort of an unsettling of roles, reversal of roles, I think, because they were scolding me for going out, which is something that I did for them not that long ago. But we relied a lot on video calls and things like online family games. And I learned how to do a really stuffed flat rate postage box to all of them. But my parents, I think, was probably the hardest part of it because they live 5 hours away. And at this time last year, my dad was in the late stages of lung cancer. And we would get up early in the morning. This was all pre-vaccine, height of the infections. And we would drive 5 hours to see them without stopping. And we would meet them in their backyard from 6 feet apart. They could see me, but they couldn't always hear me. And we would visit with them, get back in our car and drive 5 hours home all in the same day so that we didn't have to spend the night and we could be safe. But I didn't want to miss out on those last visits with my dad. We ended up losing both my mom and dad during COVID. And so we had family only funerals, but even then was really difficult because my children all coming from different states, and then my siblings, we had 8 or 9 states represented that we were all coming together twice for funerals during COVID. And it involved a lot of testing and self-quarantining and then testing again. And a lot of that was for me, but it was also just for the group in general. And then the last thing I had was my super healthy marathon running husband, despite all of our best efforts, ended up getting COVID. And his mild case was pretty scary. And he stayed in an upstairs bedroom at the house for 4 weeks and with no contact with me or anyone else in the outside world. And that was mostly per my doctors, but even more maybe from my overprotective adult children. So it's been a challenge on sort of all fronts about staying in contact with family and doing what needed to be done, but staying safe.
Yeah, thank you for sharing that, Laura. And I'll come back to you because I'm curious to know what you think did the trick for you yourself to not get infected, given everything that was happening around you. But I want to go next to Madalyn. Madalyn, you've had quite an experience with COVID. I'd love to hear you share your recovery journey since your COVID diagnosis, given that I know it's been quite a roller coaster. How are you feeling today?
So today, honestly, I feel a little down. I have a slight cough and I'm just worried because we have this new strain and I live in this state where there are the lowest numbers of vaccinated people in the area. So, you know, I had COVID right after, like within a month of the nationwide kind of shutdown. And my case, you know, my case was, they said it was mild, but I was flat on my back for at least a month. And then after I was up and around, you know, and between then and now, I still feel myself recovering. Today, I don't feel like I'm myself. And, you know, with my heart condition, there is a lot more caution that's taken since my diagnosis and since the pandemic. I've had numerous tests just to make sure that if I am, you know, ill, that I'm being treated and being treated properly. I also went actually into the emergency room one time. I did not have any symptoms of COVID, but I was being admitted. It was decided that I would be admitted into the hospital. This was this past February. Well, they put me in a COVID unit until I got my results, which I knew were negative. I had no symptoms of COVID. My problem was my chest. So, you know, and that bears a lot of weight on the mind. It bears a lot of weight on the mind. And, you know, aside from that, I have one of my very closest friends who lost all of her siblings to this illness. My stepfather, who is in a nursing home, has had the virus 3 times. He's tested positive and been asymptomatic 3 times. And in the midst of it, I've lost my stepmother. So it's just, you know, without having a chronic or severe case myself, it's just been very taxing. And, you know, with the added kind of risk for us as heart patients, you know, I question myself sometimes. Like, I find myself saying, okay, am I over worrying? Am I overthinking? Should I call the doctor? Should I not call the doctor? You know, so it's been quite a ride. It's been quite a ride. And, you know, the one time that I was admitted to the hospital, I was admitted for chest pain. And I was tested twice for COVID while I was there. They kept me for 3 days. They tested me in the emergency room and they tested me on the floor, because once they realized that my first result was negative, well, then I had been exposed. So they kept me in an extra day to test me before I discharged. And it's just, I don't know, it's just been a ride. It's just been a ride.
Thank you, Madalyn. And I want to come to Yesenia, because I know, Yesenia, you haven't had COVID, but you were at the epicenter. You were ground zero of this disease.
And I totally understand what Madalyn's pain is mentally, because even though I didn't have COVID, I did have family and family members that passed, and I was unable to go to a funeral. So my mental health kicked in again. You know, once I had my heart condition, my mental health affected me, that I needed to seek counseling, because I was constantly scared, even of my groceries, of opening the doorknob. You know, I never left my house. We were told, if you're having some heart issues, not to call an ambulance, not to show up in no hospital. So of course, having or living with depression, I was having more anxiety. I was scared of even, you know, because still to this day, I live in a high-rise building. I have to take the elevator to go downstairs if I have a doctor's appointment, and I have to share my space with other people that feel that because things are a little better, they don't need to still take care of themselves, but they don't know if I'm a carrier or you know, I'm constantly overthinking. So I decided that I needed to get some help, because your mind, I totally understand what she was saying, that she's down, but this is why we are here as a group, to support you, and we're all like sisters. I'm glad that I came on, because the more I talk to other women, I feel so much better. I don't feel like I'm losing my mind, like I'm going crazy, like, oh my God, you're paranoid, you're going crazy. No, you know, I'm scared. That's all it is. I'm scared. I don't want to die now.
Yeah. So I want to ask that if any of you have any recommendations or suggestions to healthcare providers or to patients, as the pandemic is, you know, is kind of waning, or at least we think it's kind of waning.
Right.
Variants coming, and that, you know, those are posing new problems. Do you have any recommendations or tips in staying connected or maintaining or improving your mental health? Do any of you want to chime into that? Because I think that is a struggle. And as Yesenia said, you know, we got a lot of mixed messages throughout this last year and a half. Don't call the ambulance. But then now we know that, you know, that was a cause for a lot more serious outcomes than we thought.
Yeah, Celina, I'd like to say on that, and I've heard it from the other two women here too, is that I think we have to just keep space for some new feelings and some new fears and emotions that are going to come up, because when I mentioned those family-only funerals that we had, you know, we didn't get to mourn and process with the community that my parents had lived in all their lives. Yeah. And that was necessary at the time. But it's going to create, as anyone knows who lost someone during the pandemic, we're going to have this whole extra layer of grief that we've never seen before, and we don't know what to deal with. And so I think it's important to just sort of be open to some new experiences and feelings that you're not familiar with, and explore those and just kind of be aware that those are going to be popping up.
Those are such powerful words, Lori. And any other thoughts, Madalyn, Yesenia?
Not to be afraid to tell other, like I have two of my other support group ladies that they could call me and they vent out what they're feeling. And if you need to call, we're all, you know, we should all share our individual thoughts, because I wasn't able to go to a funeral. My father-in-law passed, and we weren't able to go to a funeral. And I had family members in the island where my family's from, Dominican Republic. We weren't able to fly out for no funeral. We just recently, just like a week ago, there's still COVID is still killing individual people that think it's not going to happen to them, because they don't have ailments like heart disease or diabetes, or you know, they think it's not going to happen to them. And until us, that we are the family members, see how many other family members are like dying, and they're not specifically old. They're not.
That's right. Yeah.
It's just that this invisible virus, it's like it comes in the night and it takes you. I don't know. So I felt that I was losing my mind, because I was constantly scared, even of my own shadow. It took me at least 8 months to call a therapist and say, you know, I need help. I need a little bit of more to talk, to say, and you're correct, Lori. It's mostly the grieving part, that we weren't able to go to a funeral and pay our respects, or see our family members that we're all grieving, and on top of that, not understanding that this is still going on. Yes. Still very live. So we still have to continue to take care of ourselves and help others to take care of themselves, and how to talk to their doctors. Because that's my thing. Like I tell my ladies, you know, if you have to go to your appointment, don't take off that mask. Keep it on. Keep it on.
Yeah, closure is something where we're all missing, you know, that's really a powerful kind of gap right now. And I think you're right, Lori. we're going to be dealing with this. There's going to be a lot of lag that maybe we're not really quite understanding. Madalyn, any last words before we go to the next?
I think, one of the reasons that it said we still are in the pandemic is people's denial. And I live in a place where that denial is at a very, very high level. And so, I think that one of the things moving forward we need to have, or we need to build into our common spaces, is some way to effectively have both sides exist. I am diabetic, I am asthmatic, I am a heart patient, and I am a woman over 40, right? So when I go out and I hear people, I need to have my freedom. Don't infringe on my rights. And here I am. I've survived this. I've survived breast cancer. I've survived domestic violence. I sometimes feel like, but you are killing me right now. Um, you know, and I think there needs to be I pray that this experience, this pandemic, brings us all together around the bigger picture. I may not believe in COVID. I may not believe in the shot, but I want you to feel comfortable around me.
That is such a great point to end on, because that is, ultimately we want to come back to WomenHeart as a place that is safe for all women who are dealing with heart disease to be able to coexist with one another, to support each other as sisters, and just to have a place where you can share your feelings. And so I really appreciate each of you for sharing your stories today. And hopefully we will look forward to more champion voices in the next 2 afternoons. Thank you so much, Lori, Madalyn, and Yesenia. So nice to see all of you.